Hi, this is Valerie Sayer from Nutrition Connection Balance, and I am here today to help you learn about men and women's hormones and adrenal glands. So I'm glad you're with me. Let me get the PowerPoint started. And this will help you learn a little bit better. I'll be sending out an email with all of the information, even a handout you can follow along, and also you can go to my website, nutritionconnectionbalance.com, and there you will also have the handouts, the products, the bioidentical hormones I talk about, all those things. So those will be resources. You just go under education on nutritionconnectionbalance.com. Anyone can go there. You can share it with anyone, and I hope that you will. So as you know, or maybe you don't know, if you don't know me, I've had a private practice for over 14 years. I ran a compounding pharmacy for almost 5 years. I was the director. I learned a lot about bioidentical hormones, as well as how to interpret them, how to make bioidentical hormones, how to give specific recommendations, and so on. I'm a registered dietitian. I did a medical internship at the Cleveland Clinic, and I added on many other different degrees, as you can see. One of the things that I'm most proud of is a Reiki master, because it's something that's a form of healing that I can teach someone and they can do on themselves or other people. And then I'm a mom of 5. So we're going to talk a little bit today about what are hormones, what are the conditions, symptoms, nutrition, therapy options, testing, and balance. So number one is, what is a hormone? Hormones can be proteins or peptides, such as growth hormone, or small molecules such as thyroid or steroids, such as cortisol. So again, you can see how, why I became a dietitian first, protein or peptide. Everything that we do comes from also the food that we eat, the macronutrients, carbs, protein, fats, and especially the phytonutrients. So keep that in mind as we go along. So how and where are the hormones made? They're in the blood, saliva, and urine, as well as within the cells. Hormones made in one cell act in another and create that transmission. Saliva is actually the best way to test hormones, especially the male and female sex hormones and the adrenals. And the reason for that is they're in their free or unbound form. Some hormones are bound to proteins. This is not an active form, but there's a lot more of this. So it's really important, because what affects how you feel every day, disease and symptoms, are the free levels. So if you think of it like this, here's a lot of geese, and they're all bounched together. That's a bound hormone. So when a lot of times women and men test their hormones by blood, the problem is most people are on medications, most people are on supplements, they don't know what they're even getting. And then also, of course, if the food is poor and other things affect binding hormones, so those hormones won't show up as deficient. The free hormone is more like this. It really flies free. It really affects every tissue as well as every receptor, and also how you feel daily, which is, of course, so important. So only the free or the active hormone gets into the saliva, so that's why we test by saliva. You can test, number one is saliva, second is blood, and if you do blood, you want to do the free levels, but I still don't find they're nearly as accurate, and then urine metabolites. Always the story I think of the most when I think about any of my, just since I've lived in Chicago, over 18,000 patients, is a patient that I had that had brain cancer. And after she actually made it through brain cancer, she was so miserable with symptoms that she said she'd rather have had cancer. And that was a really sad thing to say. She had had her hormones tested over and over by blood. They were perfect. When I did her saliva testing, she actually still to this day had the smallest amount, almost zero, of any of her hormones, because of all of her chemo, radiation, prescription treatments, and so on. And so there was all bounded the cell. So the doctor and the specialist kept saying, oh, you're fine, you'll be fine, and she wasn't. So once we actually got those levels up, I still see her to this day, within 6 months, she was 100% better. So there are different hormones. There are sex hormones, which are 3 estrogens: estrone, estradiol, and estriol. This is very important. That's why I actually gave you a handout and worksheet, because when I ask men and women what hormone they're on, they'll say estrogen, or they'll say testosterone. I'll say, well, which estrogen? And then they just look at me. Or if they've had cancer, they'll say, well, I'm using a topical for vaginal dryness. And I'll say, well, you know, that's a synthetic estradiol that has, if you open the package, it says high risk for reoccurring cancer, stroke, heart attack. And here the doctor will say, or whoever's reading it or whoever's giving them an advice, that it doesn't get into the blood, so don't worry about it. It certainly does. Anything you put on your skin gets into your bloodstream. and that gets in 10 to 100 times more effective. So you want to be very careful about what you put on your skin, on your labia, or anywhere. Progesterone is the other sex hormone. It's real important to look at how the progesterone and estradiol ratio, the balance of those are, especially if you're a young woman or looking at infertility or PMS. And then testosterone is in men and women. All of these hormones are in men and women. They're not estradiol and estrogens are more prominent in women at certain ages, and then testosterone is more prominent in men in certain ages. But then as we get in our 50s and 60s, or if body fat's high, it crosses the line. And I always say men become looking more like women and women become more look like men, and it's for those reasons. So hormones really dictate. This is still one of my favorite pictures I've ever seen, because here's a little infant and he sees a statue with a beautiful woman, and this in particular to him is beautiful because this is how he gets nourished. And so again, hormones influence our body from the time we're born. So estrogen does not exist. Remember, there's three: estrone, estradiol, and estriol. E1, E2, and E3. Estradiol is what's usually given when a man or a woman, especially a woman or a young woman, has any kind of problem, whether it's depression, whether it's a period change or missed periods, because estradiol has over 400 functions. The problem is that the forms of estrogen and different things are different, and so you want to make sure that you're not using synthetic because it doesn't match your body's receptors. And remember, men have estrogen too. I look at estrogen a lot, estradiol in men, always in a men's hormone kit, because it directly influences the risk of heart disease, prostate cancer, and urinary issues. And it can show up 2 to 10 years before anything shows up in a prostate exam or a blood test. So it's very, very important. So progesterone is different kinds. Progestin. So you got to be very careful, because when you hear on the radio, you read a magazine article, they really generalize and they'll say progesterone increased the risk of stroke and heart attacks and breast cancer and different things and prostate cancer. But there is a difference between progesterone with ONE and progestin. Progestin is synthetic. The molecule does not look like our body. It's produced in the corpus luteum, the adrenal glands, and placenta during pregnancy. It's one of the things that helps break down fat. It protects against endometrial cancer. It affects moods, sleep, libido. So it's very, very important. So you can see here's the difference. So often when I say to somebody, well, what progesterone are you on? They say, oh, the doctor said I'm on natural. And I said, well, when they tell me what they're on, very rarely are they on natural. And I don't like the word natural. I like to say bioidentical, or what is the best treatment for you with the lowest risk, the most health effects, that helps your symptoms and could prevent disease, not cause it. So here you can see progesterone and progestin. Those molecules do not look alike. If you're a 2-year-old, you could tell me, are those exactly the same molecules? And the answer is no. So there is a difference. So often when I ask somebody what they're on and they say, oh, they're on something natural, and they bring in what they're on, they are on synthetic. So it's very important to understand the structure and how your body takes that in is like a key. If you have the wrong house key, even though they look the same, right? You know, a lot of keys look very, very alike, but it doesn't fit into that lock. It is very specific on how your receptors in your body fit with that molecule. It's nature made. It's the way our bodies are supposed to react. That's why food and plant foods are so important. They fit our receptors, where trans fatty acids, synthetic foods do not. So testosterone, as I mentioned, is in men and women. It's a steroid hormone. The testes secrete testosterone in men. Ovaries produce half the testosterone in women. So they're very, very important. So when we look at that, you've learned now certainly what the female sex hormones are, why it's important to saliva test first. Let's talk a little bit about some of the hormone conditions, diseases, and symptoms it can cause. So it certainly can cause PMS, premenstrual syndrome, which is such an outrageous amount of conditions today in women. 80 to 90% of women have terrible PMS, where they take aspirin or Advil every day, where they go to the doctor, where they miss school or work, where they miss college. Just does not have to happen. When you have the right omega fatty acids, when you have the right nutrition, and if needed, progesterone, 80% of PMS is better in 2 to 3 menstrual cycles without synthetic estrogen or other issues. There's perimenopause, which means you're starting to go through menopause, where you might have a missed menstrual cycle, some symptoms that change, that kind of thing. It can last 1 year to 10 these days. Menopause means you don't have a menstrual cycle for a year or more. Andropause is when men start to have changes in metabolic rate, testosterone drops, adrenal functioning changes, libido, muscle maintenance changes. Adrenal fatigue syndrome is where you just feel tired, and I always tell people, if you feel tired, it's not a caffeine deficiency. Caffeine may help the symptom, it does not fix the problem. And your adrenals are so important. They give you so much. They give you 40, 50% of hormones, neurotransmitters. They are what give your body resilience. And we'll talk about that more later. Hypothyroidism, which is 1 in 3 women that I see. Hashimoto's, Graves' disease is about every 10 women I see. Some men, which is just outrageous again. Autoimmune condition that's caused by typically hormonal deficiencies, vitamin D, adrenal issues, changes in hormones peri and post-pregnancy that have not been addressed. Insulin resistance, which causes more metabolic syndrome, higher body fat, a bigger stomach, and diabetes, of course. So what are some of the hormone symptoms? Changes in performance, whether it's libido, whether it's an athletic activity, whether it's even just at work. You notice cognitively you're not as sharp. You can't remember things. Body changes. It can be a bigger stomach. It can be a loss of body muscle. It can be osteopenia, osteoporosis. It affects bone, muscle, and brain tissue. Lower emotions, feeling defeated, less motivated. Body pain, aches, stiffness, just odd things where you don't feel as strong, and different food sensitivities. This is why I always say I'm a registered dietitian, and the LCAT is one of the best food sensitivity tests on the planet. It has multiple studies. It is not an allergy test. It signals things where the body's reacting to a food because the body's out of balance. You get the body in balance with hormones and deficiencies first. Don't waste your money on a food sensitivity test until you've got those in balance, and then you do that. And that's if you're still having any problems. I only do that probably in 1 in every 1,000 patients or less. And we do have that food sensitivity test at our office. If you want to order it, you do not need to see me for a consultation because it has everything you ever needed under the sun. And then I certainly can direct you if you need more help. Ooh, well, that went crazy, didn't it? So let me go back here. So, wow, that's what happens when you go too fast, huh? So PMS, we talked a little bit about, is a syndrome that occurs prior to the onset of menstruation and ends a few days after. The causes, they used to say, are unknown, but it's related to alterations of estrogen, progesterone during the menstrual cycle. And I'm going to tell you again, 70% is related to diet and medical nutrition deficiency in prostaglandins and omega-3s. Perimenopause, we talked about already. Typically, perimenopause is happening 35 to 55. I have 28-year-olds now in perimenopause or in menstruation where they don't have periods anymore because of stress, because of deficiencies, because of eating disorders, because of overexercise, or even deficiencies in things like vitamin D. Cycling past 55 years old actually increased the risk of breast cancer. So you don't want to be reading books and taking high doses of bioidentical to give you your period. That is not the way our bodies are meant to be. We have a certain cycle in the body, just like the moon, just like the tide, for a reason. I don't care if you believe in a higher power, God, whatever you believe in, we are made magnificent, and our bodies and food have a certain cycle to them that are meant to be. We're not meant to change that. In the meantime, as we start to get a little less serious, we'll talk a little bit about how to keep your sense of humor through all of this, because always want to see the positive changes. Mary uses her hot flashes to reheat her coffee. So I think we have to just really lighten up a little bit too and realize that we go through things because it's important. We go through different stages of life cycles because it's important. We go through menopause because we've earned that. We've had children. We hopefully have more financial security and a sense of empowerment of who we are. Hopefully we have more control and realize we're empowered over what we eat and what our bodies do. And hopefully we have a partner, friendship, or somebody, faith-based group, somebody that again is there for you so that you can, in the latest years, not worry about menstrual cycles and fertility, but be enjoying all the skills we bring to this world past 50. Symptoms of menopause and perimenopause, and this list could go on and on. Remember, I said there's over 400 functions just for estradiol, but this is very important because it's very disheartening to me that someone will have hot flashes. They'll go to their physician or gynecologist or chiropractor and they give them a bunch of hormones. Hot flashes can be caused by high cortisol. It can be caused by too high a sugar. It can be caused by sleep disruption. You don't want to be putting a Band-Aid on all over your arms when there's no cuts. You want to make sure you know what is out of balance and treat that and balance it the best you can. You want to individualize. If any of you have siblings, I have 2 sisters that are lovely adults now, but we had the same parents, grew up in exactly the same home. My parents still live in the same home. We are very different. Why would we need exactly the same treatment? Okay, so I think you're going to understand that by the end of how we want to do individual treatment with individual testing. So hot flashes, night sweats, fatigue, weight gain, depression, anxiety, heart palpitations, increased urination, leakage, facial hair, impaired mental clarity, sleep disturbances, horrible. You can't even stay asleep on the couch, but then you wake up all night. Decreased sex drive, bone loss, increased heart disease risk, change in body composition, vaginal dryness, and pain. PMS symptoms, irrationality, tension, anxiety, mood changes, depression, headaches, water retention, edema, weight gain, cravings, breast tenderness, high amount of bleeding, low amount of bleeding, just all over the board. Just as I mentioned, PMS, nutrition is number 1. The right minerals, through a hair mineral test, and the omegas. Omegas, though, are number 1. 70 to 80% of all PMS can be taken care of by the right essential fatty acids. And again, don't just go buy one. Get the omega test. It's an 8-page report. It's very inexpensive. We do a clinic for $199 with an 8-page report, all the things that you need to do, as well as a webinar so you understand. You've got to exercise. Exercise helps the receptors be more responsive to hormonal changes. You might need to use bioidentical hormones, and in that case, I use progesterone. That works if and when we have severe PMS or the minerals and omegas are not enough, which again, 70% or more within 3 menstrual cycles or less are taken care of with the minerals, and especially the omegas, by far the first. And then certainly mild anti-inflammatories, preventing ovulation with oral contraceptives. Those are the typical treatments, but they should be in that order, in my opinion. And usually it's ibuprofen's first, synthetic estrogen and birth control is first or second, and then all the rest is last. And that is not good for long-term health or for infertility and pregnancy later. So what are some of the prescription options for hormone issues and symptoms and diseases, whether it's a condition like perimenopause or andropause for men or PMS? There's bioidentical therapy. We're talking again about PMS. We really are talking about mainly progesterone, unless the woman's high estrogen is an issue, and then hormone replacement synthetic. We already talked about the differences. We do have some over-the-counter bioidentical hormones that do not require a prescription, but because I have a license in pharmacy technician as well as other license, I can get these. So again, I only use them when I test. So you want to be in the men and women female clinic. That's in November. Or if you're watching this lecture later on, it's 2 or 3 times a year I do it. So you can get into that clinic so you have that individual test. And then you may need estradiol, estriol, and progesterone. You may just need estriol if you have bone health issues and vaginal dryness or pain or urinary trouble. You may just need progesterone if you are having PMS, or even some older women that I work with, 40s and 50s, that take really good care of themselves. Often they just need a little estriol or progesterone. So it doesn't mean it has to be difficult, but these are some of the choices that the receptors match you, very, very cost effective, and again, very easy to do. I bring this up because this is my husband, John. We were not even engaged in this picture. And what's nice about this is this brings in something that I mentioned in my book, 8 Ways to Lose Your Blubber Through Hormone Balancing, and something I've seen a lot, where I'll have men and women tell me they have a low libido. They don't know what's wrong. And sometimes, I would say 50% of the time, when I get their hormones in balance, the interesting thing that happens is their libido comes back. 50% it does not. Yet when someone will go on vacation, whether it's 2 days, a weekend, or a week or 2, they will tell me they had more intimacy, 5 times. And then when they come back, I said, well, you're at work now the last few months. What happened? Well, that has gone away. I said, that is not a biochemical. That is something you need to reflect on with stress, with enough sleep, with the right nutrition, with enough, just that self-time and self-care. So be careful. Libido, 50% of the time, what I find, is not related to low testosterone or hormones. It's related to stress. So andropause is something that occurs gradually in men. And it's usually between the ages of 40 and 55. I'm also seeing this earlier, not as early as in women, but even some 35-year-old. There's a drop in hormones, especially testosterone. And think about this. If you go back and look at the old movies, I mean, black and white movies, do you see any bald men? Almost none. Because men ate unprocessed food. They had a better balance. You rarely see very many obese or unfit men in the 20s, 30s, 40s, 50s movies, and they all have hair. So it's very interesting, again, how hair loss, testosterone, all those are affected by diet, stress, and the foundation of different things. The World Health Organization says that male androgens progressively decline with age. So what are some of the symptoms for men? Tired, increased irritability, decreased libido, change in sexual performance, increase in abdominal fat, loss of muscle strength, increased lipid levels, disrupted sleep, rising PSA, urinary changes. They feel flat. They often don't say depressed. They often don't say they can't function. They'll say flat, unmotivated. Hair loss, increased risk of cardiovascular disease. They either feel like this in this picture, which isn't very funny, but again, you got to keep a sense of humor, where they feel either dragged around by life or the opposite. Then they're the aggressor. So they either tend to get heightened aggression or just such apathy that they feel pulled around by their boss, by work, by their children, by their wife, by their partner, anyone. So again, you want to feel like you're whole. So testosterone, let's talk about men and women. So for women, I almost never use testosterone. I can name by the patient's name probably a dozen women in the last 15 to 19 years I've used testosterone with, seriously. Usually if we do, we use topical. We almost always use herbal. We use DHEA and strength training. It almost always works. They rarely need testosterone. And if they do, you better be very careful, because the amount they need is so insignificant compared to men. Males, they can use topical. Typical is 20 to 50 milligrams of bioidentical. We make sure they have gloves. They put it on, turn the gloves inside out, because if they touch anything, the people in the house can get contaminated. Or you can use injectable. It's a little bit more high maintenance, but it also works very well. And typically it's anywhere 100 milligrams every 5 to 6 days. So it just depends, again, on the testing, what the patient wants to do, if there's other risks, and that type of thing. All right, so we've talked about men and women's hormones. We've talked about symptoms and therapies. Let's talk about the adrenal glands. Now, in my opinion, if you absolutely don't want to start with the hormones, everyone can be valued by testing the adrenal glands. And when we do the female and male hormone clinics, just so you know, always the adrenals are included. You cannot address the female and male hormones without addressing the adrenals. You can address the adrenals without addressing hormones, because some people don't want to do bioidentical or synthetic hormones. Some people have had many forms of cancer, heart disease, or multitude of 10 medications or more. Then absolutely start with the adrenals. These are glands located above the kidneys. They help your body adapt to stress. They secrete many hormones: DHEA, cortisol, aldosterone, dopamine, progesterone, estradiol, epinephrine, norepinephrine, dopamine. Dopamine I mentioned twice because it's one of the ones that seem to be such a problem today with lack of motivation and addictions, whether it's to food, whether it's to sex, whether it's to medication, alcohol, you name it. So it's really important. The adrenal glands are what give you your resilience. You need them to work. And as we are multitaskers with electronics and the electromagnetic force from cell phones, from computers, from iPads, from just everything, earphones, we want to have our adrenals resilient, and they also can produce anywhere 40, 50, 60% of our female and male hormones. And this is the gland that is the most insulted today. I see 5-year-olds with cups of coffee and they're tired. It's ridiculous. They should not be tired. And if they are, there's something terribly wrong. So are the adrenals important? Yes, they take over after andropause and menopause. You would die without your adrenal glands within 12 hours. Isn't that amazing? There's a few adrenal diseases I'll mention here. Rarely does someone have them. They're Addison's and Cushing's. I've had 2 cases of each in my entire career, and I'll be 53 this year. So it's very rare to have an adrenal disease, and if you do, they use saliva, then they use urine tests, and then they look at that and monitor through certain medications and steroids and so on. And again, very, very important, that is rarely the issue. It is adrenal fatigue. Because of overworking, overstress, multitasking. We use this mouse till it's no end. And again, we got to have a sense of humor. I think it's really important because when you have a sense of humor, it releases different endorphins that make you feel good. Here's a lady that she said, I'm so tired, the bags under my eyes are bigger than my boobs. We've got to say, we got to laugh about it, but then get our big boy and big girl straps up and say, okay, what are we going to do about it? We have to be responsible for our own bodies. So we have to take responsibility for our stress in our life, for our relationships, for our nutrition, for our therapies, for our testing. It is the most important money you'll ever spend because your body is irreplaceable. I always say you can get a new car, you can get a new partner, you can get a new job, you can get new degrees. You can only get one body. That's one thing. Same thing with nutrition. The only thing you're going to do your whole life is eat. So let's talk about those adrenal hormones, because if you're tired, if you're exhausted, if you have apathy, let's talk about them. DHEA, if it's low, we'll have more fatigue. Exhausted after exercise, you'll have bone and muscle loss. Depression, decreased sex drive. If it's too high, it can cause anxiety, sleep disturbances, and salt cravings. And you cannot go by symptoms. You must test by saliva. AM DHA is vital. Cortisol, too low, can cause energy issues, very fatigued, exhaustion, can't get out of bed. Laziness that people think is lazy, you just can't get out of bed. The biggest group I see with adrenal flatlined are actually people that have had multiple prescriptions or doctors and nurses because they're so burnt out. Metabolism issues, blood pressure, the vascular system is affected, immunity, and depression. High cortisol, anxiety, heart palpitations, obsessive compulsive disorder, sleep disturbances, glucose, insulin, waist fast, all sorts of phobias, can't drive anymore, just feel like they're jumping out of their skin. So cortisol absolutely is vital. It's always tested 4 times over a day. I don't even test it anymore unless someone tests 4 times a day, unless they have one level that's chronically low, then I might ask you to do that over and over till we get it right so it's closer together. We need more of this, right? Some yoga, some nature, some beauty. How do we recover from adrenal issues? And all of these issues is part of the foundation, which is nutrition. You've got to nourish and recover, nourish and recover. That comes through nutrition and self-awareness. Whole food nutrition. The less processed, the better, and the more nutrition that you have to eat processed, fast food needs to be things like the Juice Plus, the Complete. I'll explain that a little bit. Bars that don't have trans fatty acids, so that when you're busy and is easy, you can't tell me that you have to go to fast food. The 80-20 rule, 80% clean, 20% fun. 20% fun means fun that if you want a margarita, if you want some tortilla chips, if you want cake on your birthday. But that 20% cannot be something that devastates your body. If you're diabetic, you don't want to be overeating sugar. If you're an alcoholic, you can't drink any alcohol. So again, that 20% rule, there's still exceptions. So please don't use that as something that is important. And I say 99 to 1% if you are in a red flag disease state. Then you've got to be diligent for 6 months or more to see if you can turn things around. And then there's different herbs, but the herbs, again, were made to use individually. They're made in a certain form, a certain amount. 79% of every dietary supplement on the market in the United States is contaminated with lead, the wrong form, the wrong part. I am shocked, even with some of my patients, when I go over and over this, that they'll order supplements from other places. Do not do that. If you want to make sure you're on the right therapy and that you know if it's working or not, you've got to test, and you've got to take things that someone like me has tested, has a food and nutrition science degree. I get certifications for things. I private label things. I am positive that if it doesn't work or the numbers don't go up, we need a different type of therapy, not that it's going to cause lead poisoning or that it's the wrong part of the plant. And again, the people that I see with the poorest results, in fact, I have one on Monday on my schedule, she doesn't order supplements for me. I don't even know why she bothers testing, because she does not have results. So again, you want to be open to the right thing to recover, and you ask the right expert the right questions. Ask how many patients they have. Do they test the supplements? Have they used it with thousands of patients? And I have over 500 companies in my office. I'm not for one company or one product. There isn't one company that makes every single thing right for everybody, period, even when it's a good brand. I always have a supplement rules fact sheet that I send in every clinic. Please read it. There's 10 rules around a dietary supplement, not one. If you're having hormonal issues, if you're having adrenal issues, please, thyroid issues, avoid or limit as much as you can caffeine, intense exercise, and alcohol. They directly influence those systems, and it's harder to be whole. Okay. DHEA. DHEA is one of the most helpful supplements on the planet. It's one of the only ones that I think should not be on the market without a license or certification because it is abused. If a woman takes it and they don't need it or the wrong amount, it can cause high testosterone, diabetes, anxiety, all sorts of trouble. If they do need it, it has 100% impact on brain tissue, on bone density, on libido, on testosterone for women. Men, it directly affects more cognitive functioning and well-being in the pathways, overall wellness. Please do not take it without testing. DHEA, like I said, is very inexpensive. I have a liquid form. I have capsule forms. Please, though, don't take it without testing. Saliva test. Adaptogens, this is an example of one adaptogen, but it's very specific. There's maca root. There's things like that. But maca root is thrown into drinks. That's crazy. It is an adaptogen that helps with different hormonal issues, but it has a certain milligram, a certain amount, a certain part of the plant. It took me 5 years to find one company. It's the only thing I order from that company that works effectively 50% of the time. It's a very high dose. It has to be in a capsule form. So again, maca root has all sorts of wonderful magic, but for goodness sake, do not be putting it in your kids' drinks and smoothies. Absolutely could hurt them. Alethra, rhodiola, magnolia, ashwagandha, adrenal parts, all different adaptogens. The stress adapter is one I have at my office that I've used for a long time that have different adaptogens, but I still don't recommend it without testing. And if you are fatigued or tired and you do not test, it's one of the few, if you're not on any prescriptions, you could take 2 in the morning and up to 2 at lunch. And after 2 months, if you don't feel less tired, please consider testing. Okay, again, it just goes against my grain to give people things other than foundation without testing. So we have testing hormone clinics. Very important. You go to nutritionconnectionbalance.com under the events, and then at those events we have the different clinics. We have different lectures that I give live by webinar, and then under education I have taped lectures like these. I have about 7 already there that are all brand new this year. Please go and watch them. Look at the topics so that you are educated, whether you see me, whether you get supplements from me, so that you're knowing what to do that's right and the healthiest for your body. You get one body. For goodness sake, do not compromise. Saliva testing clinics. We have an adrenal stress, female and male hormone clinic. I do them all on the same day. Basically what you do is you call the office at least a month or more, and really I'd say 6 weeks before the clinic date. You want to get the kit. You want to have it, then you do the saliva testing, and then at the date of the clinic, I release a personalized webinar with the people that are in there with their individual results, all different handouts, and exactly what to do. There's a urine clinic. That one is coming up, and there again, I do all these 2-3 times a year. There's one for iodine and thyroid and breast health, and then there's also in cancer health, and then there's neurotransmitters that absolutely affect muscle, cognitive moods, anxiety, depression, bipolar, all of that absolutely should be done if you have seizures, headaches, so on. And then the other ones that I've been doing for years and years and years is hair tissue mineral analysis, and by far number 1 outside of the female, male, or adrenal is the Omega Essential Fatty Acid Clinic. If you don't have any belief in testing, for goodness sake, no matter what you are, adult, infant, or child, please do the Omega Essential Fatty Acid Clinic. It could change your life. It could prevent a heart attack. It could affect PMS, and it is part of the foundation that every adult, infant, and child needs to take. But again, everybody's so different, okay? Oh, isn't that beautiful? So we want to be out in nature more. The reason is nature fuels our soul. It relaxes our neurotransmitters. It builds up oxygen. It affects our physiology, okay? It has an electromagnetic force that resonates with your body in a positive way no matter who you are. Part of that is when we go into nature, we talked about food. Food is the foundation for every metabolic process in your body. You can't eat Subway and bonbons and expect your hormones to be normal. I don't care about your weight. telling you that you will not feel well, especially long term, and your risk for disease then goes up. Juice Plus is one of the foundational supplements I've recommended since 2001. It has 38 medical studies. It is a food. It's in a capsule or chewable form. It affects hormones for different reasons, and I'm going to go over those exactly since this is a hormone lecture so that you understand that. But I want to make sure you again understand what research means. It doesn't say Valerie said so. Research means it's randomized. It's double-blinded. That means the researcher and the participant doesn't know what they're taking. It means someone's taking a fake one that looks the same, so they don't know that they're taking Juice Plus or a certain supplement. It's tested on the product itself. That means you're swallowing that product, not an animal or test tube, and testing the blood in a human. And then it's published in a medical journal where a whole board, let's say it's in a clinical nutrition journal, it's registered dietitians with PhDs in food science and nutrition that has to determine all independently that the study was good enough to get in the journal, and then is it ethical? Are we worried about it having health effects? Are we worried about it hurting someone? So Juice Plus has all of those things. It has 38 medical, peer-reviewed, double-blind, placebo-controlled studies. And when you look, again, one of the things that it directly affects is we have to make sure it gets in. It changes the DNA, oxidative stress, because stress is what affects our adrenals and our hormones. And if you look down, inflammation, prostaglandins, inflammatory markers affect hormones, from testosterone, from PMS to andropause, and then of course cancer is directly also related to many female issues. So the question comes in that I get a lot is, why not just eat your fruits and vegetables? Well, number one, nobody's doing it. And even when I meet a raw foodist or a vegan or vegetarian, they're not eating a variety of tree-ripened 20, 30, 40 different kinds. It just wouldn't be favorable. Just not possible really today. So one of the things is there's depletion of nutrients, vitamin, minerals. A head of broccoli has a third or less of calcium, magnesium. And also what's your daily intake? So if I really followed you around every single day of your life, would you really eating at least 10 fruits and vegetables in a variety every day? And if you are, again, that includes on vacation, that includes on a busy day. Is it a variety? Is it tree ripened? And if you have anyone else living in your house, is this really true? Because let's say you have a family of 4 and we're supposed to eat between 7 and 17. So I just picked 10 because it's an easy number and it's what I aim to teach people. I aim people at 5 to 10 a day. But if you're at 10 and you have 4 people in the house, that's 40 servings a day times 7. So you're really telling me in your grocery cart, you have 280 servings of fruits and vegetables every single week, your entire life, on vacation, on hard work days, days you're sick. It's just not going to happen. So we want to be realistic and understand why we want to take something like the Juice Plus. It's body insurance. Part of how I teach people is add a vegetable to every meal. Add vegetables to your eggs and smoothies. Have it with a snack. Have hummus and carrot sticks. Have celery and natural peanut butter. Lunch, salads are the easiest ways. Have salads and green drinks. Blend into foods, okay? So it's a real easy thing to do as you get used to it. When I make turkey, when I make an egg souffle, I'll shred zucchini in there so that it's moist and you're getting servings of vegetables without even knowing. But why is Juice Plus and fruits and vegetables important for hormone issues directly? There are certain ingredients called indole 3-carbonyl, IC3, and DIM. And they particularly are found in cruciferous vegetables. They block the effects of excessive estrogen and improve testosterone and estrogen metabolism. And obviously, if we're using bioidentical hormones, we're using nutrition, we're using exercise, we want everything to be accentuated. The issue is here again, the Juice Plus is the entire food in a variety. It makes me crazy with companies, even good brands, that make DIM and IC3, and they're $40 to $60 with the one ingredient. Fruits and vegetables have thousands of phytochemicals that work together in synergy. It's the same difference as your body. Your arm is not in one corner, your ovaries in another, and your head in another. It works in synergy. So do the phytonutrients in fruits and vegetables. You can't take out one ingredient and have it affect these pathways the same. The pathways need all the phytonutrients. So this particular calcium D-glucarate is another ingredient found in fruits and vegetables, particularly apples, grapefruit, cherry, apricot, Brussels sprouts, broccoli, alfalfa sprouts, and enhances how the body gets rid of toxins. So you see the Juice Plus is really body insurance. And basically, does it actually have any human studies that proves it's helpful? Yes, it does. The University of Texas, the MD Anderson Cancer Center, they showed Juice Plus and Complete, I'll mention Complete in a little bit here, is a powdered 6 protein plant protein powder, showed the effect on Juice Plus and the nutritional status of quality of life of ovarian cancer patients. Wake Forest, approved by the National Institute of Health and funded by the National Cancer Institute. They showed that cell proliferation, the immune system, and DNA damage was less, and they had compared it to 10 fruits and vegetables or 5 with the Juice Plus and Complete, and that ruled. So again, we're not saying don't eat fruits and vegetables. You better eat as much as you can, and you can see I'm teaching you how to eat more, but you want to know why it directly affects hormones and cancer in particular. So let me give you some more motivation. So here was a study with all women. They had a high fiber diet, which is 25 to 35 grams a day. They were adolescent. They had the lowest breast cancer risk when they had 10 grams or more of fiber from fruits and vegetables. And then they had a 12 to 19% reduction in all hormone issues and a 24% reduction before menopause with just increasing fiber, especially from fruits and vegetables. And I could go on and on and on. You know, I'm not sure why we still don't believe the power of food. So let's talk about a few other hormones, and then we'll be wrapping it up. Then in particular, other hormones, insulin and glucose, are absolutely regulated almost 100% by food and your body fat. We want your fasting insulin to be less than 10. We want your fasting glucose under 100. And we want your hemoglobin A1C, I didn't write that, under 5.6%. That means that your body and your pancreas is releasing insulin, getting in carbohydrates. And we're also knowing that glucose isn't too high after you eat. And hemoglobin A1C tells us there isn't too much sugar attached to your cells, because all those things affect all the hormones. Once you have one hormone condition, you will develop all of them. Could be 2 months or 20 years, but it will happen. Our bodies and hormone systems affect each other. Vitamin D is a hormone. It's not a vitamin. It's measured by blood by 25-hydroxy-D3. Always I recommend 1,000 to 2,000 IUs, either a capsule or 1 drop a day. You can call my office and get those so you get the right form, the right kind. They found multiple vitamin D drops with lead. So again, please, there's only 2 of them that I use in my entire office for over 15 years because I'm positive they're right. And then hopefully you can individualize that is a regular serum blood test so that we could check your vitamin D. I will be doing blood clinics next year so that you can get some blood testing and make sure you have the right amounts and the right therapy. If you don't have a blood test, then call and either take a 1,000 IU capsule or 1 2,000 drop. Food matters again. Let me give you some more last motivation as we move into just the last few things. That insulin resistance. 1/4 to 1/3 of all Americans have it. That means their body releases enough pancreas, but when they eat a carbohydrate, it dumps too much and it stays in the blood. It's like going to the gas station and I'm pumping gas and I don't have the hose into the gas tank. It goes all over the ground. Well, the car just doesn't run. Unfortunately, our bodies still run, but you usually eat more carbohydrates, you gain more body fat or stomach fat, your blood pressure goes up and you feel like crap. I always say insulin resistance and diabetic patients are moody. They have low energy, they have high energy. It's not good. Half of all of our children are obese, and 20% increase insulin resistance without a breakfast. Now it has to be the right breakfast. It can't be Cheerios, banana, and orange juice. It shouldn't be, all carbohydrates. It should be mainly protein or nutrition at that. The Nemours Children's Clinic showed in a 6-month study, 6 months, just 6 months, hear me out. Boys aged 6 to 10, when they took Juice Plus capsules, just even the fruits and vegetables that are free in a children's health study. If an adult in the home takes the Juice Plus, a child between 4 and 18 or full-time undergraduate college can get Juice Plus for free, the fruits and vegetables at least. You got to buy the berries, but at least it's a lot that you can save. They only had to take 1 and 1 capsule. They showed there was good bioavailability. It means it got into the boys' bloodstream and improved insulin resistance in overweight boys. That's no diet changes. That's, again, getting the fruit and vegetable phytonutrients in their body, and they reduce abdominal fat mass in overweight boys. That could affect our entire nation, our insurance, everything, and, of course, your child. So the Complete Shake was one of the ones that's used in the MD Anderson Cancer Study, and it's one of my favorites. I have used it since 2002. And our whole family takes 1 to 3 scoops of this every single day. Every single one of us, all of our children, all Adult children take it for breakfast, and we all take it after we work out. Or if you're really stuck at work or busy, we'll put it in a shaker with water and drink it. It's the fastest meal you can ever make. It's an emergency snack, and it's an executive breakfast, as my husband says. There's 24 plant foods. It's water washed, lowest cancer rate, lowest heart rate, 2 studies using complete. It's all non-GMO, dairy-free, gluten-free, nutrition facts label, 8 grams of fiber, low glycemic index. If you don't start your morning with 10 to 12 grams of fiber, it's almost impossible to get the 25 to 35 a day. For heaven's sakes, the reason we get more than that is we put berries in there or half a banana, okay? And then we put in greens from our tower garden, or we'll put in other vegetables. So again, it's so easy if you start your day this way. You wake up fasting. I highly recommend you take the Juice Plus capsules, open the capsules, or swallow them, or take the chewable. Get a scoop of the complete. You want to add almond milk. You want to add water. You want to add some berries. You want to add some vegetables. Great. You don't? You can shake it with a shaker in your car on the way to work. Then you've still got 8 grams of fiber and 2 medical studies with the most nutrient density you'll have. When I analyze diets, I find if people add the complete shake, just that, even with water and the Juice Plus capsules, they're getting more nutrition than most people get in 3 days with all their food. Start your day out right. Start your brain right so that if you fall off the wagon, you've got the foundation in. I'm telling you, it's easy. All right, so our last thing we're only going to go shortly over is the thyroid. Thyroid's a whole different lecture. I'll go over that in the iodine clinic and other lectures. But first, you want to make sure if you think you have a thyroid issue, pretty much every woman that's in any kind of trouble thinks they have a thyroid issue. The thyroid, there's an organ right here, as you can see, and it's one of the hormones it releases is thyroid stimulating hormone. That's the one that doctors will check. You want an ideal level of 0.2 to 2. If it is lower than that, it's a problem. If it's too high, you're going to develop a problem. Every case I've ever had. You want to measure the free levels, whether you're on medication, not on medication, or if you feel like you have a thyroid problem. You ask your doctor. You've got to test T4, T3, free T3, and free T4. We will be offering this in my office soon. So again, it's been very difficult to get people the right tests, or the doctor or the clinician often will not order it. You want to make sure that antibodies are tested, because antibodies can be 50% missed for a thyroid problem, for autoimmune. So hypothyroidism is a lowered basal metabolic rate. Hyperthyroidism is Graves' or Hashimoto's. It's very confusing because hyperthyroidism, the number's actually too low or the antibodies are too high. Hypothyroidism, the TSH number is too high. You kind of have to think backwards. I think thyroid's one of the hardest to understand, whether you're a clinician or a lay person. I highly recommend you get tested, and if you don't test all of them, again, 50% of men and women are missed for thyroid problems, okay? So to end, here's my son Dylan, and when we were in a beautiful place in California, Malibu Beach, and you want to individually test, be safe, take responsibility, get out in nature. Remember, it's your body. Red blood cells only turn over every 3 to 4 months. DNA, 1 to 2 years. All your cells, 8 to 10 years. So you can have a new body, but you've got to be patient when you use bioidentical hormones, when you use nutrition. It doesn't happen overnight, but it all has health effects instead of side effects. For goodness sake, test and individualize. Build a new internal body in you every year. You are worth it is the most priceless thing you own. Prevention is a bargain compared to disease. I always find when people tell me they don't have time, they don't have the money, I'm shocked, because when they get a disease, they'll go to chemo radiation 3 times a week for 6 months. They will lose a job, a husband, a partner, a wife. And yet they'll say, again, they don't have time to exercise. They don't have time to test. They don't have time to make a smoothie in the morning. That's ridiculous. Other countries have well checks. Think about your kids when your kids are born. You take them when they're born, 1 week after birth. You know, different 1 month, 6 months, 12 months, a year, every year when they're in a sport. And once they're out, that's it. No more well checks. We go to the doctor in this country when we're sick. You want to take responsibility and get well checks so that you get your body the best body insurance possible. So here's the ending statement. This is a lifestyle hormonal change. This is one of my favorite ever written, just because I can still remember the changes even in this woman when she would come in physically. My gynecologist recommended Valerie Early, I'm married now, Valerie Sayer, as a source for saliva testing to deal with my menopausal symptoms. Now, 12 weeks later, I cannot believe how much better I feel. However, I'm not sure if it's due to the balanced hormones, 25-pound weight loss, customized exercise routine, low-fat regime, Juice Plus, or my newfound dedication to my body. But I'm better than a new person. I'm back to my old self. And she was unrecognizable when she came in 2 years later, had sold her house in Illinois, moved to Chicago, California, was single, changed corporate life, got married. I mean, just incredible, incredible changes. Don't underestimate how your body drags down the rest of your life and your career, okay? So individualized by clinics, I highly recommend you do a testing clinic if you haven't, and if you have, retest so that you know where you're at. Your body changes every year, for goodness sake. I test all of my hormones, all of my different levels, multiple times. Part of that's what I've done, but I've tested it 50 to 100 times just since I got into this work in my 20s. Please take care of your body. Share the clinic and the webinar with people. And we are so dedicated to your education and empowerment. And I hope I get to meet you soon. Thank you.